This is Heart Matters on ReachMD. On this episode, we'll hear from Dr. Valmiki Maharaj, who's the director of the Heart Failure Clinic, the Cardiac Amyloidosis Clinic, and the Cardiovascular Disease Fellowship Program at the University of Minnesota Medical School. He'll be sharing insights on how we can improve early recognition of transthyretin cardiac amyloidosis, or ATTR-CM. Here's Dr. Maharaj now.
I think the biggest step forward is just raising awareness. ATTR-CM, even though it's being considered as a rare disease right now, it should no longer be considered as rare. It's maybe considered as uncommon, but it's gaining in recognition, it's gaining in prevalence and incidence because the diagnostic pathway has been simplified. I really do think education, especially for early trainees, residents, fellows, but even seasoned healthcare providers, which may include cardiologists, primary care providers, internal medicine providers, but also neurologists, hematologists, orthopedic surgeons. All these providers are actually seeing these patients and not even realizing that their patient may have ATTR-CM. So I really do think awareness and education are really the next best steps to ensure early recognition. I do think the diagnostic pathway has been simplified and streamlined if people are able to recall that, okay, these are the red flag signs. This is a patient that has some extra cardiac signs as well. If you can go through the sequence of, okay, I looked at my ECG, I have my echo, something looks slightly suspicious between the two. This patient's not behaving exactly how I'd expect for a typical HFpEF or HFrEF patient. Then I think the monoclonal protein testing, the nuclear scintigraphy imaging, that pathway and the diagnostic steps can become relatively straightforward. And at any time that people actually get confused along the way, I think they certainly have a contact that they can get a hold of to help them along those diagnostic steps. And then finally, I really do think as therapies continue to improve, these newer therapies have shown that earlier intervention is actually quite beneficial for improving major adverse cardiac outcomes for these patients. So you'll be doing a disservice to the patient if we cannot identify this earlier. So I think the earlier recognition would be better for having a more longer lasting impact we can have for our patients and their long-term outcomes.
That was Dr. Valmiki Maharaj discussing strategies for the early recognition of ATTR-CM. To access this and other episodes in our series, visit Heart Matters on ReachMD.com, where you can be part of the knowledge. Thanks for listening.